Well, ladies and gentlemen, Jason Hetland here, 2016 Bill Ford Tough Series, right here in Sioux Falls, South Dakota. Dr. Tandy Freeman, we're right outside the sports medicine room, and last night was rough on the Cowboys, and we have some updates that a lot of dancing Australian fans will actually be happy to hear. What's the latest on Ben Jones?
Well, Ben Jones dislocated his left shoulder last night and had a fair bit of bleeding in the shoulder and arm after the shoulder was reduced. Ended up sending him to the hospital so that they could make sure he didn't have a major vascular injury. Things checked out. He was kept overnight. He's feeling better this morning. Not anything that they had to do surgically with regards to the bleeding. He'll get out of the hospital today. We'll reevaluate things as we go along. It's questionable as to whether he'll be back next week or not.
Okay, and then one thing on everybody's minds, especially after the 15-15 last night, is J.B. Mooney. He pulled out of round one and turned down his reride in round two and came back and winning the 15-15. I know he's hurting. What's the update on him?
Well, he was in a bad position on the first round. Bull bucked in the chutes with him, and he's had some problems with the elbow of his riding arm, and he got basically on the end of his arm. It was pretty sore then. He was having some problems in terms of some numbness and tingling in a couple of fingers, and just wasn't going to recover quickly enough to be able to compete that night. As far as last night's concerned, JB said that the reason he didn't take the reride is because he had the bull he had in the 15-15 and he was saving up for that ride.
Okay, so not really injury related, just a strategic move on his part.
Well, at this point in time, they're all those kind of moves are injury related, but basically he could have gotten on the reride bull. He just felt like he was better served by not getting on another bull before getting on the one in the 15-15.
Awesome, and I know you're busy, so one last thing. We talk about, sports medicine program, and everybody talks about it, but they really don't understand the depth that what you guys can do here. Talk to us a little bit about what this sports medicine program means to the PBR, and even, the other rodeos that you do throughout the year. It's a tremendous thing that you guys put on for the Cowboys.
Well, the PBR in their organization and in the PRCA, the Justin Boot Company, they're the ones who deserve credit for what happens. They're the ones who put the money up to take care of the Cowboys. Our efforts are directed toward providing the same kind of athletic training services and physician services for these athletes that they get in other major sports, the NFL, the NBA, the NHL, Major League Baseball. We have some limitations in terms of how that gets done because we don't have the guys between events to work on them every day and do that sort of stuff. And there's some limitations in terms of what's available once a guy leaves the arena. But at the arena, we try to do everything possible to make sure they get the same quality care other professional athletes do.
Awesome. I know you're busy, you guys. You got a lot of people in there needing your help, so I appreciate you taking some time with us today.
Well, thank you.
All right, ladies and gentlemen, Jason Hetland here right outside the sports medicine room at the PBR right here in Sioux Falls, South Dakota with Dr. Tandy Freeman.